Now, in the Nicotine Dependence Center where I work, we still advise patients to use FDA-approved medications. But increasingly, we're being asked, should we advise e-cigarettes? Should we advise against them? And I think that's the dilemma clinicians have been put in, and they need some solution. Hi, I'm Dr. Taylor Hayes. I'm here with my co-author, Dr. Tom Glynn. And we're here to talk to you about an article that we published. It's a commentary entitled E-Cigarettes, Harm Reduction and Tobacco Control, A Path Forward. We authored this with our other colleague, Catherine or Katie Kemper. It's currently in e-publication in Mayo Clinic Proceedings with expected journal publication in April of 2021. And just to open us, Tom, to some of us, this is something that we're used to talking about, but for many of the readers of the proceedings, this may seem like inside baseball kind of talk. But I think that as we tried to put the commentary together, we tried to make clear the applicability to everyone. And we made a number of points about e-cigarettes, where they are, what are the potential up and downsides of them, and how we can go forward. But maybe you could provide us a little bit of discussion of some of the main points, and then I can maybe pick up where I think it applies to the clinician. So
Great.
Tom, I'll turn it over to you for a moment.
Great, Taylor, thanks very much. And you're right, we tried to make this as accessible as possible to a broad readership who may not be involved in the day-to-day fighting and infighting that goes on in tobacco control. Our main message is that there's been a tremendous amount of success in tobacco control, both at the United States as well as internationally. We've gone in the US, for instance, from more than 42% of the adult population smoking, amazingly enough, in the 1960s, mid-1960s, down to about 14% in the most recent surveys in 2019. So we're doing very well, but we're starting to hit a point where there's not as much success and we're maybe flattening out. There's a number of reasons for that, but one of the main reasons and what our commentary concerns is that there has been a great deal of concern about, I'm sure anyone who is involved in public health knows about e-cigarettes and the harm reduction concept. Harm reduction being something where you try perhaps not to get rid of the behavior, but to ameliorate it, such as, for instance, providing clean needles rather than trying to end heroin use completely, or wearing a helmet for a bicycle ride rather than never going on a bicycle ride. So that's what harm reduction is. Our concern is that e-cigarettes have become a point of a flashpoint within the field as to, and people have taken two sides. One saying e-cigarettes are the way that people are going to start not stopping cigarettes, stop using cigarettes at all because they're just going to go over to e-cigarettes. The other side is saying we can use them as one of our tools to help people stop smoking. So that's been the concern, is we need to move forward on stopping combusted cigarettes, the burned cigarette. That's where the greatest danger is. The 2014 Surgeon General's report made that very clear. The 98% of the danger in cigarette smoking is to do with a combusted cigarette, not with others. Now, as far as clinicians are concerned, they're at sea because they're getting all sorts of different conflicting information. And Taylor, I know this is something that you have to deal with on an everyday basis as the director of the Nicotine Dependence Clinic. So maybe you want to talk a little bit about that.
Yeah, thanks, Tom. The clinician really is in a quandary. And I've made this point to you and others before. As clinicians, we're in the role of fiduciary with the patient. The only obligation we have is to meet the best interests of the patient who's with us at that time. And sometimes the public health arguments are just noise around us. We pay attention to them, but we really need to make decisions based on best evidence. And in the midst of this argument, we don't have best evidence. So what the article, the commentary tries to say is we need a way forward that includes some of the things you talked about, Tom, and it includes a better regulatory framework, better evidence that we can rely on as clinicians about which devices in the electronic cigarette world might be useful, better evidence about what are the real harms, and what are the comparative harms between e-cigarettes and tobacco or combusted cigarettes, so that we could start advising our patients So maybe I'll turn it back to you to make a few concluding remarks and see how we actually do make a way forward, Tom.
Thanks, Taylor. I'll just end by saying that in this commentary, which we hope you will take a look at, we suggest several ways forward. Taylor mentioned regulatory approaches. Certainly that is. We need to help the clinician. We need to have proper taxation. We need to do the things we've been doing that work, smoke-free environments and so on. So take a look if you can. We do suggest a path forward. And an important thing to remember, we've made progress, but in the 5 minutes that we've been talking here today, 5 Americans have died from their combusted cigarette use, and about 60 people worldwide have died from their combusted cigarette use. We can do better. We hope we will do better, and we need to perhaps follow some of the suggestions we make in this commentary. Thanks very much for listening.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.